Happy Wednesday, and thank you for listening to the Gee and Ursula Show. Yes, we will have Agree to Disagree. That'll be coming up in about 10 to 15 minutes or so. But before that, Ursula, we do have a guest on for the show.
We do, and we wanted to change the flow of our show because it is that important. As you know, President Biden has asked all states to prioritize teachers for the COVID vaccine. And moments after the president made that announcement, Governor Jay Inslee sent out a statement saying that educators and licensed child care workers are now in the current phase. You can sign up to get your appointment in there now. And we wanted to have State School Superintendent Chris Reykdal join us, and he does now on the Gee and Ursula Show. Good morning, Chris.
Good morning. Thanks for having me on.
Thank you so much for joining us. I know you've got a really busy schedule today. So first of all, your reaction and what is this going to mean for getting teachers back into the classroom?
Yeah, on balance, this is really good news. We have been asking for prioritization of educators through this. We were about 3 weeks away into the current phases, so this speeds things up. Educators can go quickly now. The challenge is we didn't get more vaccine, and this adds about 200,000 more folks to the existing tier of eligible people in our state, in addition to those in the very first tier, as you recall, first responders, medical providers, anyone in that tier who hadn't yet been vaccinated can still continue to do that. So it's building a little bigger backlog until the J&J comes in and a couple of these other providers build more capacity. On balance, very good news. We're moving quickly, but it does create a little more bottleneck for a short time.
What do you expect now that this decision has been made, the priority for teachers to get vaccinated? President Biden saying hopefully all teachers being vaccinated at least with one dose by the end of March. What did the state of Washington expect as far as for in-person learning for the state of Washington? What do you guys expect?
That it's going to keep building momentum. This week, we got over the 40% mark of our students in classrooms, and that's a really good thing. We've been building this great momentum. It's much higher than that in elementary school, of course, and quite a bit less in high schools. It's harder to cohort high school students. So this builds more confidence. We keep saying you don't have to have vaccinations to safely open schools, and we've demonstrated that with real data and great outcomes. But for a lot of communities, they really wanted this. This is the thing that they wanted to make as a baseline for their return, and we think it will help expedite. But as you said, Gee, this is the first dose, if you're in the 2-dose series, by the end of the month. So this doesn't happen overnight, and I got to remind everybody, when we say coming back, it's generally still in hybrid, a couple days a week for students, because we have to follow all the other safety protocols, including 6 feet of physical distancing. Because remember, kids are not vaccinated, and they're still bringing it home to vulnerable parents and grandparents. So the other protocols stay in place. We are getting more kids back, but they shouldn't expect every student back every day, all day. That is unrealistic in most communities.
Should we assume that these plans for a hybrid model are in place in all districts since they've essentially had an entire year to have some kind of plan to return to class? I guess the reason I ask that is because my fear would be if you have to just ramp up starting right now, and then also the backlog of vaccinations, you could end up at the end of the school year anyway.
Well, these districts have been planning for this. They have a required plan that they submitted to us, an update as of yesterday. There's federal dollars contingent upon those plans for reopening, again, mostly in hybrid. So we definitely believe they are ready to go in most places. Some of them were waiting on vaccine as part of the safety protocol and their local agreements. And I suspect there are still some that are going to struggle, even with vaccines becoming more ubiquitous. But the consequences for them are getting higher and higher. They're risking federal dollars. They're risking enrollment funds down the road because of parents who may not feel comfortable with a hybrid model if it persists. And there's talk of parents saying next school year, if this isn't back to what I expect, then I'm finding other options. And so these districts who are not back yet, I think, can get there with vaccine. And if not, they are going to face some pretty powerful natural consequences, mostly financial.
So follow up to that, you know that there are several districts that have already said we are not going to return back to in-person learning in any form through the end of this school year. With this decision by the governor and the president and what you've said about potentially feeling the financial impact of not reopening, is there a chance that they can be pressured to readjust or reconsider that decision?
They need to reconsider that decision. This is a really fluid situation. It has been since the beginning of this. And so definitive proclamations about things that are months away are never a good idea. This is a game changer for protecting the safety of our staff. And again, given the science of this around young kids, every district has a really viable option here to get at least their K-5 open, if not all their middle and high school students. So they should revisit that, and they should be working really hard to reopen schools to in-person learning.
This is the voice of Washington State Superintendent Chris Reykdal as he joins the Gee and Ursula Show. As these decisions are being made and the potential of these teachers being vaccinated, has there been discussion about the future, meaning the next few months when it comes to school possibly extending in the summer, any possibility of school starting earlier for next school season late in the summer? What has been the talk centered around that, sir?
Yeah, it's taking a couple of forms. We've got the legislature thinking about a couple of policy bills. They're thinking about budget ideas, so investments in our schools to have extended time this summer to start the next school year earlier, to do what we call jump starts, where maybe it's intensive math or English language arts or something for students who have been identified for additional supports. There's talk of us giving grants to school districts to start planning a more balanced calendar. Again, not adding days forever, but rebalancing our 180-day school year over more time to try to reduce summer learning loss. So all of those are in play. I think much of that will pass. There will be additional resources for sure in the form of unprecedented federal aid to do some of these things, at least for the next couple of years, to help in learning recovery.
Really quick, you mentioned Jumpstart, and that was the part where you said there was a possibility of maybe some schools starting earlier than the fall, if you will. What would be a time frame? Like usually most schools start here in the state at the end of August, beginning of September. What would something like that look like?
Couple models get talked about a lot. One is to have this actually being a little more consistent throughout the summer. So it's a day or two a year for some students throughout the entire summer. For others, they're more intensive, generally like a week. These sort of jumpstart, particularly in math. They do a lot of these in math where they say, hey, that student left us and we definitely saw that they weren't quite to the standard that I know we can get them to. And so they bring them back oftentimes for just a week. Really intensive though, so 3 or 4 hours a day for 5 days a week just on, say, a math subject to try to build their skills and get them ready to start the school year with their peers. So not talking the whole summer by any stretch, but definitely some intensive stuff, 3 days, 5 days, maybe 10 days in some districts.
The CDC, Dr. Fauci, and all of the experts are still, even though we are going through this and things are getting better, we had a virologist on the show that said that we are kind of in the fourth quarter with this pandemic. But there's a lot of thought that says that, hey, things probably won't be really comfortable until 2022. So as we go into possibly the end of this school year and the beginning of next school year, will there still be a plan in place for those families who say, you know what, I don't feel comfortable going to school? Will there still be an opportunity for those kids to still do school from home?
Yeah, I think there will, but this is going to be up to each school district to decide how they come back next fall and what options they provide to families. One of the innovations that's going to come from this is how many families said, hey, I didn't realize how much I like this, because some families really have. Now that's not mostly who I hear from, but definitely some have said, can I do this for my high school junior or senior who have to work? Or maybe they're a homeschool family and they've said, can we be part-time with the district? Can we get the benefit of your math instruction or your science? So we've got districts right now figuring out multiple options. If they don't do it by themselves, they might be in consortiums, districts banding together to say, we're going to create a permanent online learning model for families who want that. It's one of the great innovations that's going to come out of this.
So you have mentioned that around a third of all students statewide are back in some kind of in-person learning. What are we seeing in terms of COVID outbreaks? Because, you know, there is some evidence now. What does it look like when you do return and teachers are back in the classroom? Are we seeing any big outbreaks, any any things that would give you pause?
No, but there are cases, and we always want to be clear about that. Our state actually defines an outbreak as 2 or more students who aren't in the same family. So when people think outbreak, like, my gosh, that must be crazy, it's literally 2 students. And that's the bulk of them. Most cases we see in school for outbreaks are 2 or 3 students or 2 or 3 people. The protocols are great for putting those students or educators in some cases in quarantine. 0 hospitalizations so far from any COVID exposure into the school setting. We track that data really closely now with local health officials. We have pilot districts all over the state now who are using routine COVID vaccine tests to see if this is spreading in their schools. And so far, tremendous success in keeping these cases down.
I have another question, and so much has been said about mental health and the students' mental health. I think teachers' mental health too, and administrators. But let's talk about the students and student mental health. Going back and moving forward, I know that for many schools, it's the nurse or that is not something that many schools around the state can address. Yet it is such a big problem. Has the pandemic and what has happened in schools or out of schools and what that has done, the toll it's taken on mental health, would that or should that shape what we consider going forward in schooling?
Unquestionably. Absolutely. We think it was a desperate need prior to COVID. We just launched a survey that up to about 600,000 students, grades 6 through 12, can fill out. It launched last Thursday. We want to capture this from the students' voice, from their perspective, not the perception of the adults in the system, but directly from students. And what we will undoubtedly find is students have always struggled with mental health issues in a growing rate, and this has gotten worse. We do not adequately fund counselors in the state, nurses, school psychologists, social workers, and we have got to get the state to see that as a permanent investment in student success. Because if you are not ready to learn from a mental health standpoint, all the academic subjects in the world mean very little.
One last thing before you go, and I know the answer to this question already, but I just want to know if in the future, if these things are thought about as the plan for vaccinations of these teachers are going to be thrown out there. In the future, can we start to think about the school bus drivers that drive buses for these public schools and being included in that, maybe possibly?
Yeah, when we announced our health plan with Kaiser Permanente, it is for all school employees. So when we think about health measures, it is everybody, the bus driver, the custodian, the teacher, the principal. It is all school staff. And increasingly, when we think about professional development as well, when we think about teaching professionals in the school, whether it's the mental health question asked earlier or about teaching, students more of that civility stuff we've talked about on your show. We're thinking about that professional learning across all the adults in the system. You never know which adult in the system makes that powerful connection with a kid and really sparks a love for learning in school. It is often a bus driver or somebody on the playground, not necessarily always the teacher in the classroom.
That's right. Okay, Chris, with the final moments that we have left, I want to open this up to you because you have an opportunity now to talk to teachers, teachers' unions, students, and parents. With now this news about the vaccine and the prioritization of teachers, what is your message?
My message is that there are no devils in this process. Everyone for the last year has wanted what is best for their own health, for their students, for their families and their communities. And we can do that simultaneously while we keep ramping up in-person openings. We can do it pre-vaccine, and we can certainly speed that up with vaccine. But just really encourage everybody not to think about this as some devil out there who wanted something other than health and safety and success. They have different perspectives they bring. They have different reasons why they want certain things in place. And I know the bargaining table is the place where that happens, and we've got to make sure that they do that well. But we need to keep opening school. It's really important for students academically and mental health and our educators and our communities. So keep getting after it. Work hard. The vaccine is another layer of mitigation, but we've got to press through this very, very hard conversation, especially in the Puget Sound.
State School Superintendent Chris Reykdal, we always appreciate you joining us here on the show. Thank you so much.
Thanks to both of you. Be safe.
You too.